Myself, Nikita. I'm having the 15 years experience in the medical coding. Okay. So what's he mean by AAPC? AAPC is nothing but certification program. When you're getting any certification, you're going to get from the AAPC. AAPC is nothing but American Academy of Professional Coders. So you're having in this so many certifications. When you're dealing with medical coding, you're having so many certifications like CPC, CIC, CRC, CCS, COC, home healthcare, ED, ENM, you're having so many certification. So as compared to the certifications, the CPC will be the main certification when you compare with the other certification. So 80% of the market of the India and global market shares have running with the certification program. So companies have placement, and every company in the India and abroad which is running with the US healthcare will having the employment of AAPC certification segment. So is AAPC stand for the most probably and in the certification segment. So whatever the certification is done, like any certification you're done like CPC, CIC, CCS, CRC, you're going to get from the AAPC only. So what you mean by WHO? WHO is nothing but World Health Organization and the special agency for the United Nations and responsible for the international public health, and the WHO was established on 7th April 1948. So, what do you mean by ICD? ICD is nothing but International Classification of Diseases, and this is used for the diagnostic tool to epidemiology of the healthcare management for the clinical purpose. So, ICD is going to be maintained by the WHO. So, whatever the health condition, whatever the drugs, and any of the thing we get anywhere in the coding of the medical coding, it should be a double, it should be approved by the WHO. Without the approval, we can't get any code. So, which is directing and cooperating with authority with and healthcare within the United Nations. So, what do you mean by ICD-10-CM? ICD-10-CM is nothing but International Classification of Diseases, 10th revision with clinical modification. The system is used by the physician and healthcare providers to classify the all codes in all the diagnosis and symptoms are procedure recorded in the healthcare in the United Nations. So, what are the procedures and what are the services? What are the medical services are taken in the hospital? The signs and symptoms or any of the diagnosis procedure are taken in the by the provider to the patient. They all the things are given by the code by ICD-10-CM, and ICD-10-CM is used by the Australian modification. So, how the process you're going to have in the India when you get any illness or uh, s- any of the health condition, what the thing we are guys are going to do? First, we'll go to the hospital and we're going to take the treatment. After the taking the treatment, we are going to pay money. After the paying the money, they're going to get the going to, if not, we are going to claim the reimbursement for the health insurances. Okay, so there we are going to claim the insurances, then insurance company is going to pay. So as compared to the Indians, when they compare with other countries like UK and USA or any other Australian or any other countries, when they compare with India, the cost of living is more. So when the guys are want to go with other countries, they have to have their health insurances. So let us understand what is US healthcare. Okay, so when they is earning with an US healthcare, so they're going to have the three life cycles going to be having in the US healthcare. So provider is nothing but the person who is going to treat, they come under the provider, and the patient, the person who get ill, the other patient. Payer is nothing but here come under the insurance company, health insurances. This is the life cycle going to be run in the US healthcare. So, US healthcare provider, we all know that any individual who provide the medical services, for example, we can take as a general physician, nurses, and surgeons, hospital and laboratories where we can come under the providers, and the patient, any person who get any illness or disease condition to a person, they come under the patient, and payer. Payer is the nothing but the insurance company. They can insurance when you claim an insurance, they can get any time when you're having any health issues at the present and the future condition, they're going to get the reimbursement if you claim your insurance. So this is nothing but RCM cycle we're going to call as our revenue cycle management. So this is the process going to be done in US healthcare. So when a provider is treating to the patient, they're going to be recorded. What the provider is done to the patient, they're going to record it. These recorded one, they're going to send for the medical transcriptors. So what the medical transcriptors they're going to do, they're going to transcript the each and everything what are done by the provider to the patient, like patient age and patient services, symptoms and diagnosis procedure, surgical procedure have what are taken in the by the hospital by the provider, they're going to be transcribed. This transcript one, they're going to send, make it as a medical report, as where we get as an prescription or medical report in India. So as it is, they're going to make as a medical report where the patient data going to be having these medical report going to send to us where we be going to become as a coder. So coding, after the checking the data of the patient, we have to give the code into series of numeric or alpha codes. Depend upon the coding. After that, they're going to send for the client creators. Those so because they're having different clients in the when you're claiming an insurance, they're having different insurances. So that's the condition they're going to send for the client creators. After that, they're going to send for the insurance company to send the payment. After the receiving the payment of the what they have claimed, they're going to analyze the dispenses of the payment, and if they're having any of the doubt in that, they're going to call to the insurance company to get the clarification. Once they get the clarification of their entity, they're going to receive the adjustment of their entity, and they're going to get the reimbursement of this claim what they have claimed by the insurance company. This is nothing but RCM cycle. Next, what is the coding? What are the things we are going to give in the medical coding? Coding, what is the coding? Coding is the process of translating of written dedicated medical records into series of numeric alphanumeric codes. So when you are assigning any CPT code like current procedure terminology, CPT is nothing but current procedure terminology. For which condition, if a person has gone through any surgical procedure, we are going to give the code by the CPT. And what you mean by ICD-10-CM is nothing but International Classification of Diseases 10th revision with clinical modification. In this, we are going to give the when the person having any diagnosis related condition or any symptoms of signs and symptoms or diagnosis procedure which are recorded in the hospitals, we are going to give in the by the ICD-10-CM. And what do you mean by HCPCS? So what are the services like wheelchair bed or any of the medications like drugs? They are going to given for the HCPCS. So why we need to give this code means they convey the reason why they perform. What the provider is done to the patient. When you give this code only will know that what are done by the provider to the patient. When you give this code only they're going to know. So why it is important means the provider of medical biller with the information necessary to process the claim for the reimbursement. When you give these codes only, they're going to get the reimbursement of the claim. So this is an one patient medical report as a sample. So in the history means in the past history having the patient is having a complaints of the internet and the headache, and how he's had a similar headache for past 10 years, and he came now they having used occurring with 2 to 3 times in a year, and now it occurring with 3 4 times in a month. The headache was so severe that he is unable to work while having work. He described them as a throbbing pain behind the right eye. Symptoms are often associated with nausea and vomiting, and these symptoms are aggregated with the light, but there are also no visual symptoms associated with headache. So they haven't given the final diagnosis that patient having the chronic migraine. So they're having the symptoms also. With the symptoms only patient having the chronic migraine. So unless they does not given the final diagnosis, you have to give for the signs and symptoms. So what the signs and symptoms are given in the patient medical report are nausea, vomiting, and headache. So when they're not having the final diagnosis, you have to give for the nausea, vomiting, and headache. If they're having the final diagnosis, you have to give for the chronic migraine condition. What are the healthcare opportunities you are going to get as a fresher? You can become as a medical coder, medical biller, account reversible specialist, payment posting specialist, and client submission specialist. These are the opportunities you are going to have for the life science background and non-life science background students. And we will compare, we're going to hiring with the freshers and actively, and we are going to give the placements assistant with 100% placement assistant with MNC's companies which are having running with MNC's company. And how the career opportunities you are going to have in the medical code. So medical coding first, when you're getting any of the conditions, first when you're getting into the medical coding, after the completion of certification of training of program, you're going to get into the training level. We going to go into the onboarding when you go for the office. So after that, you're going to get one project related to the one department. After that, you're going to get the training level. After that, you're going to become as a mid-level as a senior coder. Then you're going to become a senior level coder. Then comprehensive means any of the thing, if you become as an auditor also, like if a person has giving any error of the code, they're going to be intimated by the auditors. So you can become as an auditor also. Learning and development. Learning and development means in the when you go in the companies also, they are going to have some trainers who are going to train for the different departments. And after that, you can become as a management of an any company of any department. So CPC. So in this, we can give how we can see the questions of the one example for the isoltensium. So what they given patient present with the pain associated with lung cancer and the left upper lobe. So and the patient came for the for which condition the patient came means patient came for the pain, and which is the pain is associated with the lung cancer. Due to the pain only that due to the lung cancer patient is pain is associated, but patient is present for the hospital due to the pain only. So first code you are going to give for the pain followed by the lung cancer. So in the medical coding, alphanumeric codes are given for the ICD-10 so here you're going to give it G89.3 and C34.12 for the lung cancer. So what is the CPT? CPT is given for the current procedure terminology. So we are going to see how they are going to give for the CPT. So the patient have a 50 years gentleman who present to the emergency room, and the signs and symptoms are acute appendicitis. Itis is nothing but the patient is having the inflammation near the appendix. So they brought to the operating room, an infraumbilical incision was made with a 5 mm visible strip trocar and inserted with 5 mm 0-degree laparoscope was introduced, and second 5 mm trocar was placed into supraumbilically and 12 mm trocar in the left lower lobe and quadrant, and the window was made in the mesoappendix during a blunt dissection and no rupture is found. So the appendix was divided and placed into the endocache bag 12 mm defect with brought forward to the visit. So the patient having the appendicitis means inflammation. To see the inflammation where the patient got, they're done with the laparoscopic procedure. Depend upon that, we are going to give the series of numeric codes for the CPT. They are going to have it 44970. Okay, so when you're getting into the medical coding, you're going to get the nice opportunities in the MSC's company. The medical coding can be eligible for the non-science background students also, and the life science background students also. It is a very nice opportunity to get into the medical coding when compared with the other IT companies. When you compare with the healthcare companies, they're having the more different when you're having any health issues or anything, you're going. So when you're getting into the medical coding is a nice opportunity to get into the medical coding, and you can get a very nice career opportunities to get into the medical coding. So when you compare with the US healthcare projects, you're going to have the payment also going to have the very high when compared to other sectors. So the when you get in the medical coding or projects or anything, the packages will be very nice. As a fresher, also you can get it's a nice package when compared with an IT companies. So medical coding is a very huge huge opportunities you're having, and you can get here in the India also, in the abroad also, you can get the job when you're done with the CPC certification or without the certification. You can go with the non-certification also certification, and the both you're having the very good opportunities in India, and more companies are developing in the India in the as for the medical coding. So it is a very good opportunity to get into the medical coding. The persons who are completed their non-life science background also and life science graduates get into this medical coding.